In response to most of your comments about aspergillosis, which you all know as Brooder Pneumonia, in today's video, it's going to be a bit longer, but I request you give it time so that you benefit from it. Brooder Pneumonia, it is a fungal disease that is from bad litter or beddings that we use in our brooding houses, but it's not a viral disease. Usually hits your chicks between day 1 to week 2 or day 14. And most of you do confuse this with other related diseases. So if you see signs of Brooder Pneumonia in your birds that are older than 2 weeks, that's not Brooder Pneumonia. And we are going to see which disease actually bring out similar signs like it. So as you see in the video, that bird is grasping. But most of you don't understand why it is like that. So what causes aspergillosis or Brooder Pneumonia? Brooder Pneumonia is caused by spores. Spores, those are fungus. So where do we find them? Usually we find them in moldy, wet litter or feeds, those who use sawdust, those who use wood shavings, but when they are moldy or wet. And sometimes it can be even from the hatchery. So once you see it, don't ignore to seek from the hatchery whether they have been having such or anything else, because more especially if you see it in the first 1 to 2 3 days, before even you embark on anything, first ask your supplier or reach out to the hatchery and find out if they had the infection. If not, then you need to go to your house and check for the following. In the early first 2 days, so the signs you see, that's normally grasping or pumping breathing. You see the bird trying to stretch the neck, pumping, or you may see rapid breathing, even at resting. You see bird resting, but you see it is rapid breathing. Sometimes you see birds sitting on their wings, sitting down, but the wings are damped. You see they reduce in eating and water intake. So that is the first 5 days. Then beyond first 5 days, we shall be seeing high mortality, that is around 5 to 50% of your flock, and that is severe. There will be no coughing or sneezing, just like in bacterial or viral disease. Just we shall only see gasping. Maybe when it's deeper, you see sleepy or they look like they are depressed, and the mortality will be at its peak. That means that around day 4, day 7, you see them being exposed to high number of mortalities, and they'll be dying at a terrific speed. So the key closures we can see here, it is just a mortality and gasping in very young chicks. But remember, it brings no gasping, no nasal discharge, no eye swellings, but only it will be gasping, and that only separates it from IB or E. coli, because with E. coli and IB you will see nasal discharge and the eyes will be watery. So as I said, you might see, as you see here, this feed, you see those caked stuff, those cause molds, and those fungus can be inherited or taken in by birds when they are young, and that will affect the growth of your birds. So risk factors that we can check on your farm, we said litter stored for too long in your stores, poor ventilation. You look at high dust during chick placement. You may look at poor brooding hygienes. Did disinfect the rooms before introducing the chicks? You see model feeds. Very many things that can lead to this. So on treatment, I know this is where most of you are interested to know. What do I use in treating these birds? People like giving antibiotics, people like giving vitamins, but they don't know which vitamins or drugs to use. Antibiotics only cannot cure, but usually we recommend to use a drug that has copper sulfate. Copper sulfate helps to treat this, and some of the maybe the sources where you can find copper sulfate are the water purifiers. So once you see this, don't rush to get medicine. Don't rush to what you have to do is one, improve on the ventilation, check for the agents that have caused this. Then maybe lastly, you missed using your disinfectants or water purifiers that have copper sulfate in them. This only will see your birds improving and see them very well, very clear when they don't have this. That means that you'll be ahead of the disease. And another thing, make sure that you don't stock feed for a long time, even before chicks come. If you stock when the chicks have not come, and once your supplier they adjust or postpone it to another date, that means that you are storing a feed that you don't know how long it has taken in the feed mill or where it was made from. So avoid keeping feed or storing feed for a long time. Those who even stock, you stock maize, takes long at the farm, also that it causes the problems. So always when you say that, communicate with your chale, most especially if it comes in the first 2 to 3 days. If they say they no, then disinfect the room, improve on your ventilation, litter, then also give it supportive care. That is, you can actually reduce on your stocking capacity. If you see now in a room or the brooder, we have 5,000 birds, 2,000 birds, and this has come in. If you have space, separate the stock, put some aside, and go with the remaining one. But be monitoring them when the stocking density or the stocking capacity is reduced. That will help you to reduce that. Add electrolytes and vitamins in your water, but which vitamins also matters a lot. So don't forget to like and subscribe for this video. You read more and more about it when you follow us. Thank you.